Multiple sclerosis, or MS, is a disease in which the immune system attacks a person's brain because the white blood cells of the blood think that the brain is a foreign object. Depending upon what part of the brain is attacked, there can be a variety of symptoms. These include weakness, numbness, double vision, loss of vision, difficulty with coordination, or urination.
There are about 450,000 MS patients in the United States, 2.5 million worldwide. We have close to 4,500 MS patients in Iowa.
To see your daughter, very healthy young lady, young age. She was just 27 when she was diagnosed with this. And then to see her 20 years later, disabled.
And it got to the point that she couldn't see so good. In fact, she can't see well enough now to even have a driver's license. She had a problem walking. Her balance is really bad.
Through the last 20 years, she's been through quite a bit. When she was diagnosed with it, we knew hardly anything about it. Well, since she's had it for the last 20 years, we've learned a lot about it.
Dealing day to day with patients whom they come with heartbreaking stories, it takes more than writing a prescription. We should have resources to provide patients with their basic needs. We have patients that they're barely walking in the hallway. They cannot afford to have a cane. This is sad to say, but it happens in this country, it happens in this state. So I have talked to Bob and Jake, and they have been very receptive. We are going to come with a plan that patients that they do not have the basic means, but they need the basic equipments to get around. We help them. We provide that for them. Any support that I get, it would go directly to the patient's care.
Wouldn't it be a wonderful thing if we help these patients with what they need, canes, beds, whatever they need to help them through this? Wouldn't it be a wonderful thing that we Eagles, our Eagle family, can be a part of finding a cure for this through the portion of the money that we give to research to. Oh, it'd be wonderful.
I'm working on MS project since 2003, and my recent research is focused on a protein, a brain-specific protein which we discovered in early 90s at the Department of Neurology. So what we are trying to do is finding the strategies to suppress the function of this protein and see if we can use this strategy for the intervention in multiple sclerosis disease. Already we have seen very positive effects in mouse model of MS, but we need to go and make these probes suitable for human use. So I think this help or funding will be very important for our lab to proceed in that direction. So I'm very appreciative for the efforts Eagles are making, and I'm very thankful to Eagles for doing this.
We greatly appreciate the effort on the part of the Eagles to raise money for our work on multiple sclerosis. Your unselfish acts will raise funding that will go towards supporting two of the missions of our department: patient care and research.
I plan to join the Eagle organization in near future, and as a token of appreciation for what they are doing, I will submit my own contribution of $1,000.
When we give this check, a year from now, there won't be a dry eye out of 300 or 400 Eagles. That's just, we work so hard for it, and then we give it away. That's what we do.